Along with me, I also have Josh Mandel, and we've been collaborating together on this Sync for Science that uses FHIR to be able to get broad set of records across multiple EHRs. So some of you may have heard about this Precision Medicine Initiative. It was also renamed as All of Us Research Program. So this is a NIH and White House-driven initiative that's a research initiative to better understand longitudinal view of 1 million cohort participants over a 10-year period, and the number could be more than 1 million, up to 10 million people, and to really engage in a groundbreaking research to understand progression of various diseases over time. So the goals of the program are, as I said, more than 1 million people engaging in research and collecting data on the genomics, the environment, lifestyle, broad set of data. And the goal is to study the interrelationships of those data elements and open for research, very broadly speaking. So this is a very large consortium of healthcare providers, FQHCs, direct volunteers, and the NIH that's starting to build the platform. And it'll be sometime later this year, it'll launch. So our role in this Precision Medicine Initiative is to build a platform, and that platform really brings together an ecosystem. So our focus is translation of evidence-based research using applied technology. So we bring all this science and scientific research and apply that towards various use cases, whether it's prevention, wellness, clinical research, chronic disease management, any of those use cases. So it's a consumer-centered platform that then extends to clinical care. And it brings the various data sources together. So the omics data, environmental, life sciences, family history, as well as all the biomarkers data. And all that data is then analyzed to derive some insights and actionable next steps for the participant. So whether we use the word participant in the case of a research, or we use the word patient for clinical care. And our model is collaboration. So we are committed to collaboration and shared findings. So in research, there are a lot of stakeholders, ecosystem comes together to conduct research. So through publications and other mechanisms to be able to provide the results back to the community and learn together. And the platform itself, as you can imagine, it houses a lot of PII, PHI. So security is very important. So we have a robust cybersecurity program that houses the HIPAA compliance and has the elements of all of the elements of data protection and privacy. So our relationship with the Precision Medicine Initiative is that we have been tasked to develop this platform that millions of people will use, where all of this data fusion happens. And based on that data, we provide insights as well as engage participants over this long-term journey using variety of different engagement methods, iOS application, Android application, web application, and other mechanisms that can help inform and engage people. It's a very hard problem, as many of you know, that Duke is clearly a leader in research, so are a lot of other people in this audience here. And there are many studies now about engaging participants for recruitment and retention. So in research studies, it's been proven, I think the recruitment can be high, but the retention rates are about 8%, something in that range. So how do you engage people and keep them interested over a long period of time? And that's really the notion of personalized engagement. So we've been tasked to create those personalized engagement, leveraging various data elements and as research principles. And we are working on taking the FHIR implementation through Sync for Science that's been led by Josh Mandel and his team at Harvard, and bringing that Sync for Science that's funded through NIH and the Office of the National Coordinator. So both of those enabled the initial implementation of Sync for Science that's being utilized, which is based on FHIR. So why we are using FHIR is, I think it's obvious to all of us that, hey, it's there, why reinvent it? And it has the flexibility, as everybody is presenting today. I'm amazed at a number of use cases and the diversity of those use cases that FHIR is able to support. So it already has that flexibility, and we found it to be very effective in both posting and getting information in a bidirectional fashion. So we are supporting all of these various clinical resources using FHIR implementation in the Vibrant platform that's then being utilized by the Precision Medicine Initiative. So I'll let Josh now speak a little bit about Sync for Science and how that came into being and what the relationship between Sync for Science and the Precision Medicine Initiative, All of Us research program is.
We have 2 microphones. Amazing. So I'm Josh Mandel, and my day job is at Verily, which is the Google Life Sciences company, where I am doing work on the All of Us research program that PJ described. But I'm also a visiting scientist at Harvard, where I'm running a team that's really focused on developing technology to make it easier for patients to share data with research studies. And the Precision Medicine Initiative is one of the first places where we're going to try some of this technology out. So as PJ mentioned, the PMI, the All of Us program, is recruiting 1 million participants or more. Some of these participants are going to come from hospitals that are partnered with the NIH, partnered with the National Institutes of Health, and they've got agreements in place about how electronic health records are going to be shared. All a participant needs to do is say yes and give informed consent, and then the hospitals can take the data out of their EHR and put it into the right format and send it over. That all works very nicely for the participants that are lucky enough to be part of one of those hospitals. But what if you're anyone else in the country? What if you don't happen to be at one of those 10 hospitals? We still want to make it easy to join the All of Us research program, and we want to make it as easy as it can be for you to share your electronic health record data. And so that's where the Sync for Science program fits in. It's about making it easy for anyone in the country, anyone who happens to see a healthcare provider that gives them access to an online portal. We want to make it so patients can share that access, take the data they have in their portal, and share it with any research study that they choose. I'm going to come over here so I can actually see what's on my slide too. So the goal is putting patients in charge and allowing them to decide where their data should flow. And we've been doing this project in collaboration with the Office of the National Coordinator for Health IT, but also with the National Institutes of Health, who's funded the project. And we've been really lucky to be working with a group of electronic health record vendors, many of whom are represented here in the room today, all of whom volunteered to participate in this project to say, you know what, we're going to improve our patient portal. We're going to add some new features to support this kind of sharing model inside, so that any patient who can sign into the portal can also say, I would like to share my data in an automated way with certain applications. So the team here has involved groups across from government to the academic group at Harvard Medical School, where I've been based, as well as the EHR vendor community. And over the course of the last 11 or 12 months, we've sat down, written a specification saying exactly which kinds of data are in scope here. And we relied very heavily on the federal regulations to decide on our scope. We said, rather than deciding all the kinds of data we might possibly want, we're going to build on what's called a common clinical data set. This is part of what CMS and ONC have put into regulations, saying that patients must have access to this data set. So we said, great, we'll start with that. If there's a regulatory mandate that patients can have it, let's build on that, take advantage of it, and get some experience working with that data set before we come back and think about what new kinds of data we want. So the value proposition that we're talking about in Sync for Science is first of all for patients and research participants to put them in charge of where they share their data, with whom and for how long, and what kinds of data they'll share. So our first customer, if you like, is the All of Us research program. We want to make sure that people have an easy way to share data with this study. But if we're doing our job right, these technologies are not specific to the All of Us research program, and they're not even specific to research. Our MO here has been, let's build on a set of standard APIs using FHIR and OAuth and the smart health IT technology that you've heard about today. Let's use all of that and take research as a use case. So we're trying not to develop any new technology that's research specific. And that's been an important ingredient in our success because it means that when we're collaborating with the electronic health record vendor community, we can take the work they've already done and leverage that work. So for EHR vendors, it, number one, gives them a clear path that's consistent with the approach they're already taking to have certified EHRs that meet all those regulatory checkboxes, but at the same time actually puts patients in charge and lets patients bring their apps to the table. For researchers, this is really game-changing because it gives a research study a way to ask for data, not just from specific partner institutions, but from any institution where one of their research participants might happen to have received healthcare. It's going to take years before this technology becomes very widely available, but I think it's going to be a relatively short time frame before this technology is available in major hospitals and clinics that are running big EHR vendor systems. I think that'll happen within the next year or two. And for technology developers, of course, it gives them a starting point with libraries, with software tools, and with a number of open components, so they don't have to begin writing an app and managing healthcare data from scratch every time. So I'll briefly describe what the workflow is for participants, which is to say, first of all, in the context of a research study, informed consent is incredibly important. And before any data gets shared, a participant needs to go through an informed consent process. That's going to be specific to a research study. The risks and benefits of participating will vary by study. But any study that's going to build an app that wants to connect to this Sync for Science API would take a participant through this conversation and explain those risks and benefits. And only once a participant had agreed would it allow them to proceed. But from there, what would happen is a participant says, here's where my clinical data live. These are the organizations, hospitals or clinics where I've been seen. And they go through a workflow, a standard OAuth workflow, which is the same way that you would approve an app to access your Facebook page or your Twitter profile, where they're sent from the research app over to the patient portal at one of their provider sites. And they sign into that portal using their regular portal credentials. And then they're presented with an authorization screen. So each EHR vendor that's been participating in this effort has built out this authorization screen with these workflows, which I'll show you in just a moment. And once the patient approves, an access token is generated and they're sent back to the research app. So in a picture, this is what the story looks like. The interchange is bracketed, if you like, on the left-hand side and on the right-hand side by an interaction with the app. So a participant would start in a particular research app, like the All of Us research app that PJ's team at Vibrant is building. From there, when they begin this Sync for Science process, they're sent into the portal, and they're given a preview of what's about to happen, an explanation of the fact that they're going to be sharing their EHR data, an explanation of what that means, and they're taken through a series of confirmations. Here's where your data is going to be shared with. Here's how long it's going to be shared. These are the types of data, your medications, your allergies, your immunizations, and so on, the types of data that will be shared. And then finally, a patient has the opportunity to view in a panoptic way, all on the screen at once, exactly what they're signing on to, what they're agreeing to, before they click approve and are sent back to the research app. One thing I want to say about this workflow is, well, yes, it puts the patient in charge of making the decision. It also builds on a patient's own access rights. So when a patient is going through this workflow, we should actually adjust the slide here to avoid the word authorization, which apparently under HIPAA has some very specific connotations. What we're deciding here is a patient's right to access and share their data with a third party. And it's a really clean thing from the regulatory perspective that we're building on that right. The conversation is very narrow and focused on, yes, I want to share. And with that, I will pause and turn back over to PJ.
Thank you. That was a very nice description. So this is all the work that Josh's team did in the last year and a half at Harvard to bring together the core set of technologies and prototyping it and making sure that the ecosystem and the EMR vendors are all engaged, and those initial prototyping has been completed. So as Josh was describing, the flow, which continues here, is that participant authorizes access in EMR. That authorization, then they also use the All of Us research program application that we are building. They authorize there as well through the consent mechanism and using of that data. And then once the authorization happens, that data then becomes available, and we start to utilize that data in the future for these various studies, and researchers will have access to the data as well as participants. One of the principles of Precision Medicine Initiative is that participants should have access to all their data. So there is a very big push towards return of results, and to make sure that anything that participant has authorized or entered in should always be given back to them. They have access to all their data at all times. And they have a very flexible model for consent management. So informed consent at the beginning, but along the way, the participants can choose to withdraw consent, modify consent. All of those mechanisms exist, and those then appropriately will inform these types of integrations and data management and data exchange with EMR. So that's the flow. This is one example of an integration that was done. So the patient-reported outcomes, we all know how important they are. So this is a mobile-based questionnaire and questionnaire response. So these are configured by the Vibrant platform, very flexible tool set that creates these different questionnaires and surveys. And these were then collected from the patients, and these are using the FHIR schema that sends information back and forth with the electronic medical record, and getting that information, getting it back to the central repository. So this FHIR interface is used to transfer it from the patient technology, participant technology, to a central warehouse repository, the data and research core. So that schema is utilized to exchange these questionnaire and questionnaire responses. And this is just an example, but over time, all of those data types that we had described earlier are going to come in from the electronic health record and then be utilized in the overall participant study. So that's our presentation. Happy to answer any questions.